All right, welcome back, Dr. Morales, and I am proud to introduce a new procedure I'm offering to my patients, and it is called the Corset Contour. And so, we've been talking about it for a little while, but I'm really excited to be offering the procedure to my patients. A little background of the procedure, it originated out in South America, has definitely started kind of making its way into the United States, and I think it's a very, very, very powerful procedure that can be a game changer for women and men who are looking to get their waistline smaller. The history of getting waistline smaller is not a new desire. Look at the 1900 century, looking at corset training. More recently now we have waist training with these athletic waist trainers. All the same concept is to kind of get that smaller waistline and give you a little more curvy areas of the female form and or men form. So the evolution of getting this waist contour, one of the options was historically to remove ribs of the lower rib cage. And so that's a very, very aggressive procedure. It didn't really catch on very well. You have a lot of issues with complications. You can damage adjacent structures like the lungs and the abdominal wall. It was just fraught with complications, and that's definitely one of those procedures that never really took off, mostly for the safety and complications aspect of it. But there's now this new technique where we can just remold the rib cage, and what we're going to be doing is the lower ribs of the rib cage are T11 and T12, and these ribs are unique in that they're not attached to the cartilaginous skeleton of the ribs T10 and up. And so these lower ribs are really kind of setting the waistline right before it gets into the abdominal contour of the lower ribs. And so if you're one of those women that find that you're always kind of built straight, that's what they tell me, I'm built straight, where you don't really have a lot of a small waist, is your hips are very much the same as the width of your chest. And so this straight kind of illusion, that's really an anatomical problem. It's just, we're all made different, right? I want to say it's a problem, just we're all made different. And so, you can do all the liposuction contouring you want, you can do fat transfer hips to kind of get an illusion of a small waist, but then it just becomes, a little disproportionate, it just looks a little odd, because the natural anatomy is that you have a wider waist in relation to your hip and chest structure. So this procedure is infracturing the lower ribs of the rib cage, T11 and T12. And what we're doing is doing a very precise cut on the posterior surface of the ribs, and we infracture those two ribs, and we're able to mold it using a cast, which is called a corset. We're going to be casting those ribs into now a more smaller circumference. And so the bones heal, and then now you have a brand new smaller waistline that is permanent, which is just a game changer. I mean, the patient's desires are now going to be able to be attained in having a smaller waistline when they're not naturally built like that. So talking about the procedure itself, this procedure is really indicated for those women who are going to be a little bit leaner. My body mass index kind of limit is going to be around the 30 mark. And let's talk about that. The reason why you need to be a little bit leaner is because if you have a little more intra-abdominal fat, right? We carry organs, we carry abdominal fat. If you have more intra-abdominal fat, this fat will be compressible. And so if you can take your rib cage and you can take a deep breath and suck your abdomen up, and your abdomen gets a lot smaller, then that's going to be an indicator for me that I think this would be a good procedure for you. If you cannot do that, when you suck up your abdomen, we call it the vacuum in bodybuilding. If you suck around, you can't make it change too much, not going to be a good procedure, because if I infracture those ribs, it's like squeezing a balloon. It just goes out the front. And so you might get a smaller waistline, but it's going to come out the front, and you'll get more of a kind of a poochy abdomen. So it just doesn't make sense. So those women who are a bit leaner, I have a lot of athletes, I have a lot of people in fitness, a little bit leaner, and I'm built straight. I can now do a controlled infraction of those lower ribs and give you a naturally smaller waistline, have more of an hourglass figure. And so I think this is a great procedure for them. Those options of, fat transfer where you don't have a lot of fat, and then basically taking the fat and sprinkling it on your butt for more volume enhancement to get that hourglass shape, it's just not going to work. It never works out very well. And if you're not one of those patients who really want more full butt with implants, this is a new option that I'm going to be able to give you, because you'll have a new kind of silhouette at an anatomical structure level. And so you'll have a beautiful shape afterwards permanently. So those of you who've been doing waist trainer and trying to get your waist smaller and love how you look on a waist trainer, you know, this is a procedure for you because it is gonna be a game changer in your physique. You know, whether you're a bodybuilder or whether you just want to look better in a nice fitted dress, your waistline is going to be forever changed in a great way. Some of the complications associated with the procedure, the known complications that have been described in the literature, and again, it's not a new procedure. You know, some of the procedures that we perform a little more with deeper soft tissue manipulation, such as this one. You know, the incision is very small. It's about 1.5 centimeters, which is, you know, about an inch basically. And through that small incision, I can access the posterior surface of T11 and T12 ribs. And I do a controlled cut using a very special instrument called the piezotome, and it only cuts bone, only cuts hard tissue. It's like a cast saw. If you ever had a broken bone and they cutting your cast off and you're worried they're gonna come arm off, they're not gonna, it won't cut anything soft. So it won't cut skin, it won't cut fat, it won't cut any fascial tissue. And so it's a very, very, very safe instrument. It's the only instrument that I'm comfortable using for safety. And so once that cut is made, then I put a little gentle pressure and then it infractures.
Oh, there you go.
Yeah. It's a very controlled technique. The procedure itself takes me less than 15 minutes on both sides to do all 4 ribs. And so it goes very, very quickly, minimal bleeding. And then I am always double checking that I have not damaged any other adjacent tissues such as, you know, abdominal cavity or the chest cavity. And so I always confirm that that has not happened. All that soft tissue is reconstructed. I basically put sutured material, put it all back together, and the small incisions heal amazingly well. In the recovery setting, what they're going to be using is a corset type garment. And so it is basically a corset. And this is so important for this procedure because a patient is going to be able to control how small their waist is. Once those ribs are infractured, the more pressure and the more you can tolerate, the smaller your waistline will get. And when I tell you, you can come down 4 to 6 inches, this is such a fact. I'm telling you, I've seen patients come down 6 inches from 30-inch waist to 24 inches like that. And that's permanent. The days of waist training was over. The days of even wearing corsets to try to get a smaller waist, those are over because those are never permanent. So super powerful procedure. The recovery goes quicker than you think. You know, it's not going to be a pain-free procedure. Your first week after the procedure, it's going to feel like a kick in your ribs. You know, it is what it is. I have a specialized protocol for my pain management with a local anesthetic that lasts for about 3 to 4 days. On top of that, we're going to be taking different classes of pain medicines to help control the discomfort associated to the bones itself, the nerve pain, and the fascia pain. So after that first week, you know, you'll be finding yourself off with the narcotic pain medicines, getting back to normal life, but you still got to wear that corset for the next 3 months. And so you'll be able to work, you'll be able to drive. That corset is going to be that cast. I need that corset to be your cast, okay? And then that way your bones heal as quickly as possible. So that's probably the biggest downside. And if women who've ever worn corsets can find that a little uncomfortable, I found one specifically where I feel that's very comfortable. It's a little bit flexible. You know, it doesn't compromise, you know, breathing and eating. You're able to do everything normally. But the goal of this procedure is that we are going to get you a smaller waistline you will never believe. So if you're interested, don't forget, reach out to us, send us a call. You can find a contact inquiry on drmorales.com. Love to hear from you. I cannot wait to show you the before and afters of this procedure. Thank you for following.